Today's tumor topic of the day is mast cell tumors. They are a very frustrating cancer, both for cancer specialists like myself and pet owners, because one size does not fit all. Mast cell tumors from dog to dog can behave very differently, and that's really one of the take-home messages I want you to get out of this video. Mast cell tumors are the most common skin cancer that we see in dogs, accounting for about 15 to 20% of skin tumors. So there are some really good mast cell tumors, which are, even though they're malignant, are very benign. And then there are some mast cell tumors which are much more aggressive and are going to require a much more aggressive therapy to manage them, and maybe even more than one thing. So maybe surgery, sometimes radiation, and sometimes chemotherapy. But they are very treatable tumors. So even if your dog was diagnosed one of the higher grade tumors, I want you to listen to me. They are treatable tumors. And I've had dogs with high-grade tumors that have metastasized or spread internally, and we can still manage them, and those dogs have great quality of life on their therapy. So again, I want you to have some hope as you're learning more about these scary tumors. Okay, so I told you that they're the most common skin cancer. Who gets this cancer? Tends to be a cancer of middle-aged and older dogs, and we see it in golden retrievers, boxers, Labrador. If you guys watch any of my videos, you know that I'm a huge Labrador lover, schnauzers, pugs, and Boston Terriers. But again, every dog is at risk. And I have seen this cancer in a 6-month-old puppy. Today, just at work, I was talking to one of my nurses about seeing it in I think a 16-week-old puppy, so 4 months old. So guys, it's a cancer that does not care, does not discriminate. So early detection is going to be super, super important. And you know how I feel about feeling our dogs and our kitty cats too once a month for lumps and bumps. So again, early detection is going to be really key for success, not only in mast cell tumors, but other skin cancers and subcutaneous tumors. So there's tumors just under the skin as well. Most commonly, we're going to find them on the trunks of our dogs, and second most common location is going to be their legs. So when you're doing that monthly exam, I want you to really feel your dog from nose to tail, the trunk of their body. You want to get in their armpits, especially if they're a hairy breed like a golden retriever, maybe a Bernese mountain dog, really fluffy breed. You really got to get in there, and you want to feel their toes, and you want to feel their entire limb. Third most common location is going to be head and neck. So again, you want to do a nice, thorough monthly exam of your dog, feeling them for lumps and bumps. Guys, ton of resources for you on my website. So Dr. Sue Cancer Vet, we're going to put a link in the video. I have my skin map. Dr. Sue, what the heck is a skin map? This is something you can print out. And so if you find a lump or bump, you can just simply go and track it and mark where you found it on your dog. Was it on the left? Was it on the right? And then you can even, measure it. And if it's hard to remember where it is, or you have a really fluffy dog, you can clip the hair over it. And I will even encourage my clients to circle it with a Sharpie. So, and the other thing, how do I measure it? You can use a tape measure, but one of the things that I like is calipers. So I sell these on my website. They're pretty inexpensive. It's really important that you help your veterinarian find these lumps and bumps. Guys, you're with your dogs way more than the time that we have in an exam. What are my guidelines for lumps and bumps? If the mass is the size of a pea, see something, do something. If you see something, if it's the size of a pea and been there 1 month, so it doesn't get smaller, doesn't go away. This is a pea, guys. This is a centimeter. If it's been there a month, you want to go to your veterinarian, and we're going to do a simple test called an aspirate. I have lots of other vlogs. We'll put some links below where you can see what an aspirate is. Pretty easy procedure where I stick a needle in the mass, collect some cells. We look at them under the microscope. Mast cell tumors are usually relatively easy to diagnose with an aspirate, and either your vet will look at those cells under the microscope or send it off to the lab for confirmation. What's also important about a dog that has a mast cell tumor, so again, if you're watching this and your dog was diagnosed with a mast cell tumor, and that could be a year ago or just right now, about 10 to 20% will develop another mast cell tumor. And that may be in a couple of months. I have some dogs that will develop a mast cell tumor a year, and then some dogs will develop multiple mast cell tumors pretty close together. I say they cluster them. And some dogs will come in with 3, 4. I've had one dog come in with over 12 mast cell tumors at one time. So we're going to have to approach those a little bit differently. Those are definitely good ones to get, to be able to go see a cancer specialist. But again, about 10 to 20% of dogs with a mast cell tumor will develop a new mast cell tumor. So I don't mean that it grows back where the surgery was. They develop a completely new mast cell tumor somewhere else on their skin of their body. Okay, so what do these look like? And this is another reason that mast cell tumors are frustrating. We call them the great impersonator. The classic mast cell tumor is a raised, hairless, pink mass. But they can also look like lipomas, those benign, hairy masses that are squishy. So, and sometimes they're firm. And one of the things I always say, and the reason I developed the See Something, Do Something, Why Wait Aspirate program is I can't look at a mass, your vet can't look at a mass, you can't look at a mass, you can't send me a picture on Facebook, or any of these social media channels. I cannot look at a mass and tell what it is. We have to collect some cells and look at them under the microscope. Okay, so I said, let's go back to one size does not fit all. So what does that mean? So once you get the mast cell tumor removed, and we'll talk about that in part 2 where we talk about surgery, we're going to get some really important information. Most of the time, when a pet comes to see me, the cancer specialist, we have that biopsy report back because usually it's been removed either by the primary care veterinarian or the surgeon. So, and that grade, which is in the biopsy report, is really, really important. It's not the only thing, but it's really important in helping me help the pet owner predict how the mast cell tumor is going to do. But it's not the only thing, and that's why mast cell tumors can be really annoying. So what do I mean by that? So when we get the biopsy report back, it will grade the mast cell tumor. So those are levels of aggressiveness. And usually the classic grading system has been a 1, 2, 3. A low-grade mast cell tumor or a grade 1 mast cell tumor is very unlikely to metastasize or spread. So usually we'll say surgery is curative for those dogs. And that's great news. There's some other information, we'll come back to that. On the other end of the spectrum, remember, one size does not fit all, we have the high grade or grade 3 mast cell tumors. 50 to 95% of those will metastasize or spread. And then we have this grade 2 in the middle, the intermediate grade. And what we learned is about half of those will spread and half of those don't. So if your dog had a grade 2 mast cell tumor, what do you do? And so it wasn't really helpful because some of them were cured with surgery and or radiation, and some of them went on to metastasize. So there's been a lot of research over the last 10, 15 years to really better define those mast cell tumors. Grade 3, usually you're going to need chemotherapy. Still treatable. Remember I said these are treatable tumors. Grade 1, usually don't spread. And then these grade 2, where about half of them potentially will. Now there's a 2-tiered system. They didn't just get rid of the middle. They came up with a new classification system, studies to prove that it was good, and they just have a high, low. And they've reanalyzed it and sort of reclassified what they're going to look at. And that has also been shown to be very predictive. So when your dog gets a biopsy report back, your veterinarian, your cancer specialist should be telling you grade 1, 2, and 3 and high, low. And so that will help us with more information. And then there's some more information that when you go see a cancer specialist, you want to find out about, something called the mitotic index. What is that? Mitotic index is how many of the cancer cells were dividing at the time they got the biopsy sample. A really high mitotic index has been shown to be associated with a really short survival time. And a really low mitotic index, which is a good thing, has been shown to be associated with longer survival time. So the more aggressive the tumor is, the more quickly it's dividing, the dogs didn't live. And what's the difference? It was the difference between 3 to 4 months and about over 2 years, about 2.5 years. So, but again, not one thing, guys. I don't want you to be like, oh, my dog's mitotic index was high, so I shouldn't treat. We have to put everything together. And that's where someone like me, seeing someone like me, a cancer specialist, is helpful. And this is a really complicated tumor. And watching this video, guys, does not replace seeing a veterinarian or seeing a cancer specialist. And I know it can be hard. I'm a busy working mom as well. I know how hard it can be. And there's not a lot of cancer specialists. But talk to your veterinarian. Try to see a cancer specialist if you can, because these can be complicated tumors. So we talked about the 2 grading system. We talked about mitotic index. And a lot of the times we'll do a prognostic panel. And that's where they run advanced testing on that original biopsy that gives us some more information. One of them that's really important for when we come back and talk about treatment is, does your dog have c-KIT mutation? c-KIT mutation. I know, it's like mind blowing. You're like, too many things I have to learn. You can stop. you can go get a cup of tea or maybe a different beverage and come back and watch this, because I know it's a lot of information. But c-KIT mutation has been associated with a poor prognosis. About a third of dogs with mast cell tumors have this mutation, been associated with an aggressive behavior. So if I can find out they have that mutation and I'm going to put my patient on chemotherapy, I'm going to use Palladia in that protocol. Again, what I want you to get from this video, this is a common cancer. It's one that if you can find it smaller, it's going to be really successful, because when you watch the treatment one, I'm going to talk about how important it is that we get big surgical margins. So we need to find these tumors early. Before we leave this video, the other thing that I want you to know is some weird things that mast cell tumors do. So in the little cancer cells, teeny cancer cells, they contain some substances, and one of them is histamine. If you guys have allergies, it's the stuff that makes your nose run. It's an inflammatory mediator. So mast cell tumors are notorious for getting bigger and smaller, because your dog will bang down maybe on a hardwood floor, or if he has a tumor on his leg or his side, or on, you know, a tile, or chew at it, because these tumors can be itchy, and the tumor gets bigger and red and inflamed and then gets smaller. And you'd be like, well, a tumor wouldn't get bigger and smaller on its own, but it's the histamine getting released into the local tissues and then gets absorbed. Also, it can release heparin, which is a blood thinner. So sometimes these tumors will bruise. A dog that has metastatic mast cell tumor can have issues with the histamine that's circulating in the blood system and with the heparin as well. So your veterinarian or your cancer specialist may put them on additional supportive medications like an antihistamine and a stomach protectant to help deal with some of these symptoms associated with the things released from the mast cell tumor. If your dog has had a mast cell tumor that's been completely removed and no signs of spread, I don't usually keep them on their medications. Can I make recommendations for your dog in this video? Absolutely not. I'm just giving you an overview of mast cell tumors, and I feel really passionately about giving pet owners good information about tumors, but I am not trying to be Dr. Google. So hopefully you found this video. Make some comments. Let me know what you think. Watch part 2, where we are going to talk about treatment. We are specifically going to be talking about surgery, which is so important, and a little bit of radiation and chemotherapy. I hope that you found this helpful. Cancer is, very common in pets. 50% of dogs over the age of 10 will get cancer. And so I'm really trying to get good information out there. So if you can do me a favor, please subscribe. If you like this video, share, comment. That's how I get the word out there. Let's kick cancer's butt. I hope you'll join me for the next session, where we're going to be talking about mast cell tumor treatment. Thanks for joining me.